Hi there, and welcome to the Made to Mom podcast. I'm your host, Dr. Alexia Priolo, naturopathic doctor. On today's episode, I'll be discussing guidelines during pregnancy and the first year postpartum. Earlier this year, um, we got new guidelines for exercise in the postpartum period. And so I thought these are so important to share, especially since I see a ton of people during pregnancy and the postpartum. And oftentimes, like beyond stroller walks, like they want to know like okay like what exercise can I do, like what are the recommendations, and we finally have some recommendations, which is so exciting. So first what I'm going to do is go through the pregnancy recommendations, and then we'll talk about what those postpartum exercise recommendations look like. So, in my practice, when I see clients in the first trimester, oftentimes we're talking about exercise in pregnancy. So, pregnancy is a unique time in a person's life where their lifestyle and choices, including exercise, can have a significant impact on their own health and the health of their growing baby. That said, only a small percentage of women are participating in regular activity itself, never mind the 150 minutes that's typically mentioned and recommended. Now, this might be because there isn't enough information provided at prenatal visits about safe pregnancy activities or the amount of exercise needed per week. And furthermore, many people worry that exercise might increase the risk of miscarriage. Nevertheless, participating in exercise is associated with reduced adverse pregnancy outcomes and adverse fetal outcomes. Notable adverse pregnancy outcomes include gestational diabetes, gestational hypertension, preeclampsia, depression, and more. So, in pregnancy, Canadian guidelines state that all women should be physically active during pregnancy, and they should at least reach 150 minutes of moderate intensity physical activity each week to achieve clinically meaningful health benefits and reduction in pregnancy complications. So, in people less than 29 years old, a moderate intensity is about 125 to 146 beats per minute. And then in people older than 30, a moderate intensity is about 121 to 141 beats per minute. Physical activity should be accumulated over a minimum of 3 days per week. However, being active every day is encouraged, and a variety of aerobic and resistance training activities should be incorporated to achieve greater benefits, which also includes like yoga and gentle stretching as well. Now, for people who've been active in the past or who've been inactive in the past, they're encouraged to engage in physical activity in pregnancy, but they may need to start gradually and at a lower intensity. And as their pregnancy progresses, they can increase the duration and intensity of exercise. Now, not all physical activity is safe in pregnancy, and the guidelines list safety precautions to be mindful of, which include avoiding physical activity in excessive heat, especially with high humidity. So, this is like hot yoga, avoiding activities which involve physical contact, like hockey, or a danger of falling. For instance, non stationary cycling, avoiding scuba diving, and people living below 2,500 meters should avoid physical activity at high altitude, which is greater than 2,500 meters. Now, safe and beneficial exercises in pregnancy include walking, stationary cycling, aerobic resistance and stretching exercises, dancing, and water aerobics. But a person should stop physical exercise immediately if they notice continuous shortness of breath, which doesn't resolve with rest, severe chest pains, regular and painful uterine contractions, vaginal bleeding, continuous fluid loss from the vagina, which may be suggestive of membrane rupture, and then continuous dizziness or faintness, which doesn't go away with rest. Now, there are contraindications to exercise, and then there are two types to be aware of: relative and absolute. So, Relative contraindications are exercises that should be discussed with your primary or obstetrical care provider to discuss the advantages and disadvantages before starting exercises. So, some relative contraindications include a recurrent pregnancy loss, gestational hypertension, a history of spontaneous preterm birth, twin pregnancy after the 28th week, eating disorders, etc. There is a bigger list in the show notes that you can take a look at. And people living with absolute contraindications should not participate in moderate to vigorous intensity activity. A more detailed but not complete list is available on my website as well. But some of these conditions include unexplained persistent vaginal bleeding, placenta previa after 28 weeks gestation, preeclampsia, a high order multiples pregnancy like triplets, and uncontrolled hypertension. Okay, let's dive into these new 2025 set of guidelines that were released in the British Journal of Sports Medicine about postpartum physical activity, sedentary behavior, and sleep. And I'm just going to talk about physical activity and the sedentary behavior. So, the postpartum is a critical time, especially for people at increased risk for future chronic diseases. So, early interventions can be introduced to hopefully enhance long-term health outcomes. Postpartum individuals are at heightened risk for conditions like depression, weight retention, type 2 diabetes, and cardiovascular disease. And some of these conditions are more likely to occur in people who experience gestational diabetes and or gestational hypertension or preeclampsia in pregnancy. Now, after birth, light physical activity is encouraged. So, this might be like gentle walking, deep breathing. When I personally had a cesarean birth, I was encouraged to start walking as soon as I could. Obviously, like being mindful of my stitches. Um, I also had a vaginal birth, and I found being active after the vaginal birth was a little bit easier because, like, well, how do I say this? I didn't have like the same hesitation or like the same feeling that I might have popped a stitch. Like, I remember going for a walk in my neighborhood. I was like, oh my gosh, like this feels great. And so I pushed it and did my normal route instead of my like modified route. And then I remember coming home, I was like, oh my gosh, I think I overdid it. And I remember asking my partner, I was like, did I pop a stitch? Like, are my stitches okay? And luckily they were. But I usually just like tell people now, like, try not to push it because like 5 minutes after you might be like, oh my gosh, like I wish I was heading home instead. Um, in any case, like once the surgical incisions or even perineal tears, if you had a vaginal birth, have healed and vaginal bleeding, and this is known as lochia, is not increasing, you can likely progress to moderate intensity to vigorous intensity physical activity. Now, I'll just kind of say that before actually progressing to that, like it might be helpful to see a pelvic floor physiotherapist. Like you'll have your 6 week check in with your midwife or your OB. Maybe they'll check your stitches. Maybe they won't. They might just ask you, like, how's baby? How are you? Great. See you in a subsequent pregnancy. And so I often recommend that people go ahead and visit their pelvic floor physiotherapist if they have one, or if they have the means to do so, consider booking an appointment with one just to kind of like assess the pelvic floor and see, how it's doing. And can you go ahead and progress back to the activity that you were doing in the past? For instance, like if you were running, like if you were a runner in the past, can you commence that? Like, when can you commence that in the postpartum? So, the 2025 guidelines do recommend postpartum pelvic floor muscle training to reduce the risk of urinary incontinence and rehab pelvic floor muscles, which have been impacted by pregnancy and birth. And so, I've been in practice for almost a decade now. I've worked alongside like many pelvic floor physiotherapists, and they typically recommend coming back to see them at least 6 weeks postpartum to determine the proper technique for pelvic floor exercises. The guidelines like talk about like Kegels, but like not everyone should start with Kegels. Like you might have a pelvic floor and you wouldn't know that unless you had it assessed. And you wouldn't want Kegels to tighten like an already tight, or yeah, tighten an already tight pelvic floor. Um, and also just noting that even if you had a cesarean birth, like you would still benefit from seeing a pelvic floor physiotherapist in the postpartum, because basically like you do need to rehab those pelvic floor muscles after like 9 months of a pregnancy. So in the first 12 weeks postpartum, it's encouraged to accumulate at least 120 minutes per week of moderate to vigorous intensity physical activity accumulated over a period of 4 days. Now, ideally, this should include aerobic and resistance training activities, but no specific preference was noted in the guidelines. And they also recommend to limit sedentary time to about 8 hours or less, which includes no more than 3 hours of like recreational screen time. So that might affect contact naps. Like I remember when my kids, like they would only nap on me, usually not for 3 hours, but if you're sitting for like a 2 hour period, like holding a baby, it would be great afterwards once they get up to kind of get up and move around to kind of break that sedentary time. There are relative and absolute contraindications to moderate to vigorous intensity physical activity. And an absolute contraindication, as I mentioned above, is like when you have a condition where physical activity should be avoided until the condition is resolved, just because of the increased risk of adverse events. However, activities of daily living are often encouraged, whereas a discussion with a person's healthcare provider is needed to assess the risk and benefit in participating in an activity in the case of a relative contraindication. So, if you have any concerns about a particular condition or contraindication, please speak to your healthcare provider. The list of contraindications is pulled from the guidelines and it will be uploaded to the episode page on my website. But some conditions include like severe abdominal pain, vaginal bleeding, not associated with a person's period, a C section with symptoms that worsen with activity, for instance, like pain around the surgical incision, unstable blood pressure, so something over like 140 over 90, a new onset of chest pain, discomfort, and other angina like symptoms with exertion, dizziness, or lightheadedness during activity. I know acutely that the postpartum period can be difficult and it might be tough to meet these recommendations. Like 120 minutes, that's 2 hours of activity, or at least like, 30 minutes per day. But that being said, any progress, even small, can help to improve maternal physical and mental health. So, thank you so much for listening to this episode about exercise during pregnancy and the postpartum period. I really hope that you found it helpful. If you've been pregnant, let us know, what was your favorite activity to do during pregnancy. And same goes for the postpartum as well. And if you found this episode helpful, please subscribe to this podcast, leave a review, or follow me on social media. Thank you so much, and I'll talk to you next time. Take care.